What is your understanding regarding nasal polyp? How does this occur? Nasal polyps. Okay, the thing you have to understand is the air will enter through the nostrils. After that, it will pass through which meatus? Middle meatus. So the thing we have to look into is whenever there is narrowing, there will be increased velocity of the air flow into that area. Okay, so this will pull down the mucosa eventually. Okay, so in what all cases narrowing can occur? Narrowing can occur when there is edema, right? In which cases edema occur? In infections, like in allergies, etc. Okay, this is what is actually happening. So, then explain me what is nasal polyps. So, nasal polyps are the edematous nasal mucosa. Okay, do you think it is a painful condition? No, it is not. Does it bleed? No, it doesn't. Okay, what is called as probe test then? Probe test is when we pass a probe. This is the nasal polyp, and when we pass a probe, it can go around this nasal polyp freely because nasal polyp are structure which are formed from somewhere else and hanging down. Okay, so a probe can pass easily. That is called probe test. I just mentioned it. Okay. Then what are the causes? I already told you that is due to edema. Edema can occur due to many cases, right? So in case of chronic sinusitis, there will be polyp formation because of edema. Okay. Then what are the reasons of polyps in adult, in children, and what are the reasons for bilateral and unilateral polyps? Okay, let's discuss one by one. First one is in cases of adult bilateral polyp. Okay, the first and most important cause is allergic rhinitis. Okay, how do we know whether it is because of allergic rhinitis? Allergic means there will be history of allergy, right? In case of allergy, which is the component causing allergy? IgE, right? Type 1 hypersensitivity. So there will be increased IgE amount. And what is the most common presentation? Patient will have sneezing on waking up. Okay. Then, so the patient have allergic rhinitis. What will be the treatment? Give anti-allergens. Okay. Then we can give decongestant for around 7 days, maximum up to 7 days. Which this will reduce the edema and all. We have nasal spray containing steroids. It will reduces the edema, infection, etc. And if this doesn't resolve, what we'll have to do? We have to excise the nasal polyp. Okay. Next, what is the second most common reason for bilateral nasal polyp in adult? It is aspirin hypersensitivity. Then other reason is eosinophilic granulomatosis polyangiitis. Okay, it is otherwise known as Church-Strauss syndrome. Okay, there are mainly different presentations here. Maybe patient have chronic sinusitis or he may present with asthma. For that, what are the other features present here? Patient may have systemic functions like systemic involvement like peripheral neuropathy, cardiac involvement, GI involvement, etc. So, what are the investigation we have to do? It is eosinophilic. So, the IgE amount will be increased. And the thing is, the eosinophilic compound will be more than 10%. Okay, what will be the treatment? It is, what do you mean by actually eosinophilic granulomatosis with polyangiitis? It is the inflammation of small and medium arteries, vessels. Okay, so it is inflammation, right? So we have to give steroids. It is an immune mediated, so we have to give cyclophosphamide. Then what is the other cause? It is Young syndrome. How does patient present with Young syndrome? Patient have chronic sinusitis, may have bronchiectasis and infertility. Okay, what will be the investigation we have to do? Nasal endoscopy. For all the cases we can do a nasal endoscopy, and we can also do non-contrast CT. Okay, these are the causes in adult. What are the causes in children for a bilateral nasal polyp? Most common thing we have to look into is cystic fibrosis. It is the most common cause. So, what is cystic fibrosis? It is an autosomal recessive disorder, and what is happening here? There will be thick mucus secretions. What are the investigation we have to done is we can analyze the sweat chloride amount. It will be more than 10 milliequivalents per liter. It is a diagnostic of cystic fibrosis, and we can excise the polyp and we can give antibiotics to prevent the infections. There will be many systemic infections in association with cystic fibrosis, so we have to give antibiotics. Then next disease is primary ciliary dyskinesia or Cartagena syndrome. Here what is happening? There will be chronic sinusitis, bronchiectasis and dextrocardia. Next one is unilateral causes of nasal polyps in adult and also in children. Okay. First one, the main two things we have to check into this is bacterial and fungal infection. For bacterial infection, what will happen? There will be unilateral involvement only, right? And we have to give antibiotics for bacteria, growth prevention, and we have to give nasal spray. Okay. And if doesn't resolve, we have to do functional endoscopic sinus surgery. And in case of viral infections, how this viral infection get occurred is when a patient have allergy, the patient have a history of allergy and he inhales an fungal agent. Okay, and the patient have allergy to this fungal agent and it will cause allergic reactions causing thick sticky secretions, and this is known as string-like mucinous secretions. Okay, and this string-like mucinous secretion is due to eosinophils. Okay, what will be on CT scan? There will be double density sign or rail track appearance. What is the management? It is the, do we have to give any antibiotics? No, right? Because it is fungal and it is mainly due to allergy. So what we have to do? We have to remove the allergic fungal agent. Okay, and there is no need of antifungals actually, but if the patient doesn't resolve, we can give itraconazole after the surgical excision of the polyp. Okay, and post-op we have to give nasal steroids. Then what is the cause of unilateral nasal polyp in children? The most common cause of unilateral nasal polyp is androcoanal polyps, and it is due to, actually it is the growth from maxillary sinus and it grows posteriorly, okay, into the choana. Okay, so there will be only unilateral involvement, right? What will be the clinical feature? It goes posteriorly, so there will be hypo voice. The voice will be little low than before. Then there will be change in voice, right? And there may be bilateral nasal obstruction, because if they grows bigger, it can cause nasal obstruction. Then what we have to do a CT. Then we can find involvement of the maxillary sinus. Then treatment is excision of the polyp and we can give antibiotic. Okay, then what are the two types of nasal polyps? One is androcoanal polyp. I already told you how this occur from the maxillary antrum, maxillary sinus. Then is it unilateral or bilateral? It will be unilateral. It will be single or multiple. Single. What is ethimoidal? Just opposite. It will be multiple, bilateral, and there will be history of allergy.